We are live.
Hey Neil, it's Dr. Raj and Cherie here on Let's Talk, and we are glad to have you with us, Dr. Raj.
Glad to be here.
Oh, always a pleasure to see Dr. Raj come in the studio. Champion Heart and Vascular Center right here in Dunn, and that is at 710 Irwin Road in Dunn. That number 910-304-1212. And you guys are about to go on a new adventure in Holly Springs and Oxford.
Yes, a Fuquay Arena.
Ah, yes. So that's gonna be another adventure for him. That'll give you how many offices?
So 4 offices.
4 offices. So they're in Dunn and Henderson and Oxford and Fuquay Arena. So they're expanding. So they're doing something right. Exactly.
Thank you.
He's got your number.
Yeah, we are the champions. Yes.
Oh. Neil always finds a theme song for whoever we bring in. He always finds a theme song.
Yeah.
Oh my goodness. Champion Heart and Vascular Center. Now, you a lot of people have to go into the hospital to have tests run, and it's so uncomfortable. It's so, I don't know. None of us want to be in the hospital, but if you've got to have tests run, being in the hospital kind of gives a little uncomfortable, unease feeling. But you folks figured out a way to do it right there in the office.
Yes, we do almost all the cardiac and vascular tests in the office, which is more pleasant, and it's non-threatening.
Mm-hmm.
That's what I feel. And I have done my test in the hospital, and I know how alienating, or it's too many things to go through.
Yeah.
It's a big hospital, and infection risk, first thing, is higher in the hospital.
Yeah.
And very low in the office.
Yeah. Wow. And that's a big factor.
Yes,
that is a big factor. So many people, it's easy to be infected in the hospital. I've got to where I don't hardly even like to go into a hospital unless I absolutely have to.
Definitely. No one wants to go to hospital.
Yes.
My thing is prevention is better than cure.
Yes.
So why hospital?
That is.
Yeah, today we are going to be visiting hospital.
Yes. Today we are talking about echocardiography, and that is an ultrasound of the heart. So tell us about that.
So, there's 2 ways they say it: echo or echocardiography. Some people say it's echocardiogram. And, when you think about echo, what do you think? What do you?
Repeat it.
Yes. Echo.
Yeah.
When you make a sound, it comes back to you.
Uh-huh.
We use the same phenomena, like a sonar, like the submarine.
Yeah.
They use sonar waves. So we use an ultrasound sound. This is a sound which is beyond human hearing. So we give the sound, and then the sound waves reflect back, and we take as a pictures.
Wow.
And it's a painless test.
That is amazing.
Yeah, no radiation, no pain. And we can do in the office, and you don't need any preparation.
Uh-huh.
So it's the same like the baby scan, where they check the babies.
Yeah.
Same we do on the heart.
Uh-huh.
We put a gel and a probe, and they touch the heart, and they don't touch the heart. They go on the skin,
Uh-huh.
and the waves are pulsating, and you get reflected waves, and you can see the heart. So using the mathematical equation, we can see the heart valves, heart muscles and the tubes which are coming out of the heart, like blood vessels. Everything can be seen.
Wow, that is incredible. I'm just blown away by the medical field and what they can do and the instruments and the machines that they use. My sister works at Siemens Medical in Cary, and my brother-in-law, and I'm just anytime he goes in for an x-ray or something, he looks to see what kind of machine they're using. But it's amazing at the machinery and what it can do and tell you as a doctor. It's just crazy. So echocardiography or echocardiogram,
Yes.
okay, is an ultrasound of the heart. Just amazing what they can tell by that, the pulsations. And
so yeah, echo takes care of, if you think about as I told you, as a house, we have electrical system, we have structure, and we have plumbing system. Echocardiogram or echocardiography looks at the structure of the heart. It does not look at the electrical system of the heart. So if someone has shortness of breath and we think that heart is not pumping good, and most people use a word called congestive heart failure. This is the most reliable method to identify if a patient has a congestive heart failure. And we can actually visualize the heart without opening the chest. Actually, every part of the heart can be visualized with echocardiogram.
Oh my goodness, that is crazy. That is wild. I've never really thought about it before. You hear of people having to go in for, EKG and all those things and all the acronyms. But you don't really think about what you folks see. That is amazing.
Yes. As I said, I got fascinated by cardiology when I started looking at the echoes, where you can see the echoes of every patient, and and it will give you a reason where, let's say someone has a valvular problem, and if they have, let's say they have a fluid around the heart, everything can be checked.
Wow.
And this is one of the tests. It's very simple. It takes not more than 45 to an hour, and painless, and no real preparation is needed. And almost every cardiology office has an echocardiogram, and it gives a baseline how your heart is functioning.
Wow. It just tells, which direction you go in for the doctor. It's like, okay, that's working fine. This is working fine. A process of elimination, I guess. But now your office is right here in Dunn, and we want to let people know you don't have to drive long distances anymore. You can go right here down the street, right at the corner of, I think it's Dunn Irwin Road and Powell Avenue, right there at the corner for our locals where Dunn Discount Drug used to be. And you went in and you revamped that whole building, and it looks great. And so our people can go right there to where you are.
Yes, it is open 5 days a week, and we also work on the weekends.
You do?
But only for a call. But please do not call us on the weekends. I'm just kidding you. If that is, but we do. We do take calls 7 days a week. But patients can walk in at any time, and we take all insurances and no insurance also. We have a sliding scale for patients who are poor, and we can have a payment plan. So they do not have to go and say, hey, we do not have money, how am I going to see a doctor? They can still see me, and we could have a payment plan. Similarly, the test that I was talking about, the echocardiogram, it's usually when you go to a bigger hospital like Duke or WakeMed or UNC, those are enormous charges. They would charge upward of $2,000 per echocardiogram. And the echocardiogram done in the office is less than $200.
Oh my goodness. Is that not crazy? I mean, not only do you save time but you also save the patient money. If they can come to your office versus going to a hospital, and I can see, a hospital, they have to schedule, so many things. But going to your office, I mean, cuts down that much money. Absolutely go to the office. Now, you guys don't do surgery.
We don't do
Right.
surgery, but we do procedures. Sometimes we feel that heart surgeons may hate us because most patients who come to us doesn't need a bypass surgery.
Yeah.
We could do stents by preventing a bypass surgery, a vascular surgery. Everything can be done through a small needle. And the techniques have changed a lot that most patients does not need an open heart surgery or any bypass surgery at this time and can be treated locally.
Wow.
And we have techniques where we can do roto-rooter and clean the arteries.
I
And
like that,
we can get it
roto-rooter. Neil, that's one of your words, I'm sure. Roto-rooter. I have heard that before whenever someone was talking about those procedures. But, can you imagine if you don't need open heart surgery, not having to have it just because you've got to do something, fix a little something minor? My goodness. Absolutely. So, we need to get the word out about Champion Heart and Vascular and the different locations. Of course, you're right here in Dunn at 710 Irwin Road in Dunn. And then you are in Henderson. Now, that location is 511 Rowan Creek Road. And that is Suite 106. And that's in Henderson. That phone number there is 252-572 4223. And, if you're closer to that area, by all means, call and go to that location there in Henderson. And coming soon is your Oxford and your Freakwave Arena office.
Yes.
So, and he definitely will keep us informed whenever that comes open. Now, you mentioned that you take most insurances pretty much, even if you don't have insurance. If you're a self-pay, you're not left out in the cold. They're not going to leave you to, suffer. They're going to help you if they can. I guarantee you, Dr. Shashadri and Dr. Raj will do that. Now, a lot of people think, well, okay, who is this guy? What are some of his credentials? Well, let me just tell you, if you look up Champion Heart and Vascular Center, you will see a plethora of mega credentials. This gentleman sitting in the air chair here today, he has been a part of Duke University School of Medicine, Yale University, Brigham Women's, and they're at Harvard University. My goodness, Cedars-Sinai. Okay, so you're mega qualified to do what you do.
Yeah, I think I went through all the schools, but it is the way that you need to treat people. I learned cardiology, then I went through a training for vascular, then veins. So you have to go through too many schools. My wife said, when are you going to stop studying? And when are you going to when are you going to start working? So I went through.
Professional student.
Yeah.
He is a professional student.
So 14 years of school.
Wow. Oh my goodness.
After high school.
Woo. My. 26 years. You should be smart. You should be smart. You should know what you're talking about, Dr. Raj. You should. Absolutely.
Maybe. I'm scared.
I'm sure you do. Maybe. After all of this schooling, I'm sure you do. Yes, and that's what we love about Dr. Raj. You're just friendly. It's almost as if we've known you forever.
Yeah.
And I tried so long to get him on the radio, and I just finally made the right connections. And we're just so proud to have you as part of WCKB's family here. And you opened your facility because you genuinely care about people, and you're not out there to take them for a ride just to get their money. You genuinely care about their health, and because you are a fellow of the American Society of Echocardiography, or FAS is the acronym, which recognizes exceptional practitioners. So he is an exceptional practitioner. I know you're not going to tell people that, so I'm going to. And he has an extraordinary commitment to the field of cardiovascular ultrasound and the cardiovascular health. You are a jewel, and you
Thank
are
you.
genuine. And, you can see him on Facebook. In fact, he's doing Facebook Live right now as we're talking. But I do appreciate your, I think for you, it's more a relationship and the patient, and your tenderness toward the patient to help that patient. And that is almost a thing of the past.
Yes. I like to, some people tell me as a chatterbox, where I
You're in the right
like
radio station.
I can be a radio jockey, I think.
Yes, you could.
Yeah, I love to talk to the patients. The one thing which is missing in cardiology is connection with the patient and patient's family, because the more you talk to the patient, you get more history.
Mm-hmm.
And to treat a patient, first thing is you need to know the patient very well. Anyone can do hundreds of testing,
Yeah.
but testing does not equate to your knowledge in
Yeah.
talking, and trying to find their family history, what their hobbies are, because you will know a patient who says, I have no problem. I know that there is some problem because they used to do some hobbies like walking in a golf course.
Mm-hmm.
They used to do golfing. Now they're not trying to do that much, mainly because they have reduced their activity levels, mainly because of heart failure,
Mm-hmm.
or something with the leg issues.
Mm-hmm.
Only by talking to them we can figure out. And most people think they're getting old.
Yeah.
Old doesn't matter, because elderly still have to have the same amount of energy. If they have a reduced energy, it is not just the old age. It could be your heart.
Wow.
Maybe your heart is not pumping enough and not giving enough oxygen to your
Mm-hmm.
tissues.
And you feel like it's just energy levels
The
are
energy
dropping
level
because
is
you're
low.
getting older.
Mm-hmm.
Wow.
And second thing is, you may think my legs are hurting, and some folks thinks it could be also age-related or arthritis, but it could also be a sign of heart disease,
Mm-hmm.
where you're not getting enough oxygen to your tissues in the leg. So if you have low energy, you have a shortness of breath. These are the indications to get an echocardiogram.
Wow.
And see your doctor or talk to a cardiologist,
Mm-hmm.
where you could be identified before something strikes.
Right.
Because once a heart disease comes, you can't undo it, but you can prevent something.
Wow. That's cool. That's cool. Wow. And then now you are registered as outpatient endovascular. Y'all, I'm learning these words too. Endovascular Interventional Society. And that means every patient that you have and the procedures are reported to them nationally, and the outcomes are peer reviewed. So you're not just, all inconclusive in-house. You have people looking at the test results. Patients get the best care and treatment, even better probably than at some hospitals, because all the tests are administered according to the highest standard of patients receiving that thorough investigation, so to speak, or right up.
Yeah, so we follow all guideline-based and nationally recognized guidelines. So any patients who comes in, we follow the guidelines, we read the studies according to the guidelines, and all the studies are peer-reviewed, which means the standard is very higher,
Mm-hmm.
or more higher than many other practices.
Mm-hmm.
And we have monthly and 3-monthly meeting to go over the studies and have a discussion about what can be done more, better.
Mm-hmm.
So we not only do the critical review, but also we try to achieve best than before. So every time we wanted to achieve higher than higher.
Right.
And only few outpatient facilities get the standard IAC accreditation, and we are one of those in the country.
Wow. So I tell you, you obviously you want to trust your doctor if you're going there for physical care, and with your credentials, with your standardization, and your love of patient. Where else could you go that would be any better? I mean, and then the comfort. You're trying to make it as easy on the patient as possible, given a good environment for them to go to be tested, and to make them feel at ease. I mean, obviously, like Neil and I were talking earlier, nobody wants to go to the hospital. Nobody wants to go have to have EKG or echocardiogram or whatever. We just want to live, but we also know that we have to take care of ourselves as well. So you are one of those professionals that can help us make sure that we can maintain optimal health and have a good life and not have any surprises.
Yes. I think very important, as I told, is we need to avoid having problems, cardiovascular problems. And first thing is prevention. The only way to get prevented is by having a good knowledge about cardiovascular diseases and education. So doctor means to teach. That is the meaning of doctor. So I love to teach my patients to say, take care of themselves. That's the main thing. You do not want to chase the tail. Yeah. You need to chase before anything comes in. Yeah. So first thing. And second thing is, you need to live your life longer and die younger. It doesn't mean die younger means not age-wise. Even if you're older, right, you have to be stronger, have no ailments, and you need to die younger.
I like that. That is a good. That is awesome, man. Well, I just me and my husband walk in the morning, and I've been trying to do a little. I'm not going to call it running, because I just do lift my feet off the pavement, but I do try to run a little bit. And I think, okay, I need to get my heart rate up. I don't run very far. My daughter is the runner, but I feel like, okay, at least I'm moving. I want to stay moving. I want to stay active. But I don't run a marathon. My daughter runs those, but I don't run those. I guess if a snake were after me, I could run further, but but we want to make sure that you stay healthy too, our listeners. And we just appreciate so much Dr. Raj coming today. And you can check them out. They're right here in Dunn, right here at the corner of Powell Avenue and Dunn Irwin Road, at 710 Irwin Road in Dunn. That number here locally is 910-304-1212. And if you call, they'll get your information, get you set up with an appointment. And I think you even have some that just walk in, don't you, doctor?
Yeah, most of the times, we take all walk-ins.
And that's good, because so many times you can't even get in a doctor's office a lot of times without an appointment. But they're flexible in that they have in-house testing. You can become a new patient. You don't have to have a referral.
No.
Is that right?
You do not have to have a referral. Only one insurance which needs referral is VA, Veterans Insurance. The second one is Medicaid. These are the two insurances which will need a referral.
Okay.
But almost all of the insurance do not need a referral. They can come without a referral.
That's wonderful. That's wonderful. So you have payment options, if somebody needs payment options. Now, what are your hours?
So we are open in Henderson and also in Dunn from 8 a.m. to 5 a.m. I mean, not 5 a.m. I meant 5 p.m. Actually, I'm awake at 5 a.m. anyways. Yeah, I say 8. Yeah.
He's a bionic man.
Okay. So you understood, isn't it? 8 a.m.
Yes,
to 5 p.m.
5 p.m.
5 days a week, on weekends, if there is any issues, we are still on call.
Okay.
Dr. Seshadri is always on call, and on the weekend. So any other issues, we take care of them.
That is wonderful. You can't beat it. So it's heart, veins, vascular procedures, not surgery. They do procedures here at Champion Heart and Vascular Center. And for you lucky folks in Fuquay and Oxford, you're going to be getting they're going to be in your town pretty soon. So hopefully you can, if you're in those areas, you can go see Dr. Raj and Dr. Seshadri. And I guarantee you are going to be in good hands. They're dedicated to what they do. Obviously, with all the schooling they've had, 14 years, you said, plus
maybe 14
school?
plus. I didn't really calculate properly.
Wow.
But I should be. but minimum 14 years. Ooh. After high school.
After high school. So that's a lot of education, and he has compiled it to help his patients. And what a wonderful service. And we're so thankful that you're right here in our hometown. Neil, so many years we've had to go to Raleigh or Fayetteville, or we've had to go out of town to get good medical care, specialists. And now, thank God, we are getting some good specialists right here in our hometown. And Dr. Raj and Dr. Seshadri are two of those at Champion Heart and Vascular. And tell the people again where you are and a number you can be reached at, Dr. Raj.
Yeah, so we are now in Henderson and also in Dunn. The number to reach Dunn office is 910-304-1212. It's 910-304-1212. And Henderson, it is 252-572-4223. It is 252-572-4223. So
and if he can remember all those numbers, he can work on your heart.
Yes.
Again, it's not the surgery, and it's the procedures. And I know we've talked before about so many getting the oxygen to the legs and that sort of thing. A lot of people think they may have diabetes, when in essence it's no oxygen.
Yes.
Going.
Yeah, it is. So if you think about heart as an engine for the whole car, so like
I love these analogies.
Yeah, for the human, it's the engine. So it actually pumps the blood, and every organ needs oxygen. This is the major pump.
Yep.
So we have to take care of the heart. And another thing I forgot to tell about echo is, some may have read the echoes, and echo gives a number. Mm-hmm. It spits out a number called ejection fraction. The normal is 60%, and no one has 100%. So when you see an echo report from your doctor, and when they say 60%, it is normal. So don't have to panic.
It's like, I'm a little short from 100.
Yeah.
Well, you have given us some good information today, Dr. Raj, and we just so enjoy you coming in, Neil and I and the whole gang here at WCKB. We always look forward to seeing you. So if you need to make an appointment, or if you want an appointment at some of the other facilities, if you'll call the local number here at Champion Heart and Vascular Center at 910-304-1212 and get with Dr. Raj and Dr. Seshadri. I'm sure they're ladies there in the office would be glad to help you out, to kind of navigate you through the system and get you there and get you straightened out, whatever the problem may be. And who knows, there may be things going on that you have absolutely no idea are going on, and these folks can help you out with that. And we just appreciate having them so much, Neil, here on WCKB. Thank you, Dr. Raj, for showing up today and being with us.
Thank you so much.
All right. Okay. Here's your song.